Good morning or afternoon. It's lunchtime anyway, isn't it, for everyone? Welcome to this first seminar in a new series that we've set up through the TAPAS network. TAPAS, the Tackling Air Pollution at Schools network, is one of the 6 networks set up by a collaboration between the Natural Environment Research Council and the Met Office, looking at the interaction of indoor and outdoor air quality, and our project, our network, is associated with the question of air quality at schools, and in particular the impacts on children and children's health. The network is an open network, and you're very welcome if anyone is on this seminar and is not part of the network and would like to be. Please contact either me or Sophie Bristow, who's the coordinator, and we will put you on our mailing list. Just a couple of housekeeping things before we start. Would you please make sure that you're muted, and would you please turn off your cameras so that we have the most bandwidth for the presentation. For questions, we'll reserve questions to the end, but if you have them, please put them in the chat, and I will mediate the question session at the end. And the final housekeeping thing to say is that we're recording this presentation, so if you don't want to be recorded, please keep your camera off and keep your microphone muted. So this is the first in a series of seminars that will take place at Thursdays at 12:30 for the next 7 weeks. It's a pleasure for me to introduce our speakers today. We're going to hear from Ben Barratt, who's a reader in environmental exposure and public health, and Deputy Director of the Environmental Research Group at Imperial College, London. He's involved with participatory research with communities, wants to disseminate knowledge and for policy impact. And he's pioneered the use of portable air quality sensors in public health research, and we're going to hear some of the results of that now. And following, this is going to be a double act with Diana Varaden, who's a postdoc research fellow in the Environmental Research Group at Imperial, and she's interested in air pollution and interactions with social science and policy. So it's a great pleasure, and I'm very pleased that they both agreed to give this presentation. I'm going to now hand over to Ben to start the presentation. So thanks, Ben.
Thank you very much, Paul. Welcome, everyone. I recognize that we're an extremely diverse group today. I recognize some names, don't recognize others. I'm going to keep, Diana and I are going to keep the presentation fairly broad, and some aspects will be more or less technical to some of you rather than others, but I'm very happy to answer follow-up questions more technically and specifically after the presentation. So we're going to be talking about the Breathe London Wearables study that was carried out a couple of years ago. And following up from Paul's introduction, if we're thinking about children and their school day, it's important, if we're going to develop interventions and improvements to the child's health and their environment, we need to understand how they're exposed to this risk arising from air pollution, where and when the risks are highest. But of course, children's exposures to air pollution are pretty heterogeneous. They can be based on weather conditions, geography, their own behaviour, such as how they commute to and from school, the school environment itself while they're at school and what they're doing there, and of course the home environment. So there's many different aspects here based on all sorts of physical, behavioural and social variables that we need to try and understand. So we designed and constructed a pretty large scale study for its kind to try and first of all characterize the children's exposure during a typical school week using portable sensors, and also importantly to assess the extent to which this citizen science approach that we were using could contribute to and impact the outcomes of the study. So I'm going to present about the first part, about the exposure components, and then hand over to Diana, who's going to talk about the more social science and citizen science aspects. Very briefly, a broad study design. So this was preceded by some work looking to identify the most appropriate, relatively low-cost portable sensors. And this resulted in working with Dyson, and Dyson made us around 100 backpacks. So those backpacks had the sensor housed in the front of the pouch, and the remainder of the bag was empty, and that was to allow the children to put their school books, packed lunches, etc. in the rest of the bag. So effectively we said, here you are, this is your school bag for the week. Just use it as normal as you would a normal school bag, except for using it to fight other children at school, and don't stand on it. And they lived with that backpack for the rest of the week. Gave it to them on Monday lunchtime, and they carried it for the rest of that until Friday lunchtime. We worked with 5 primary schools, not on the same week. So we did one school 1 week and then moved on to another school. But in each school, we distributed these backpacks to around 80 children. And in total, we managed to monitor over 5 weeks, 258 children and 30 teachers from those primary schools. Some pretty impressive statistics in terms of volume of data that we gathered. Due to the high logging frequency of the backpacks, we captured nearly 500 million measurements over that time period across 2,000 school journeys. We also carried out a number of engagement activities, which Diana will talk about, around education science, sessions, surveys, focus groups, and interviews. So it's a combination of qualitative and quantitative data gathering. Those I'm an air quality scientist badges turned out to be really quite an important part of the study. It's funny how something really small actually has quite a big impact. We gave the kids the badges afterwards, and actually the teachers wanted some of them as well, and various local politicians decided they wanted an I'm an air quality scientist badge as well. So precision was particularly important with this study. We wanted to really compare the different children on the same day in the same part of London. So we carried out a co-location test at one of our reference monitoring sites, with all the backpacks were placed on the roof alongside a reference monitor. The backpacks, I should have said, monitored PM2.5 and nitrogen dioxide, as well as GPS position, temperature and humidity. And we're going to focus on the PM2.5 results today. So one of the reasons we selected this particular sensor was because it had pretty good accuracy and precision. And you can see from the chart there, across the 80 bags that we co-located, we had a very stable R-squared of around 0.8 against the reference monitor, and a pretty stable calibration factor slope of around 1. Some of them dipped below and did not perform so well, so they were taken out of the study and replaced by one of the spares. So we can be pretty confident in PM2.5 results. One of the reasons I'm not presenting the NO2 results is because we're less confident the calibration was not quite so successful. So one of the beauties of monitoring 80 children all at the same time in the same part of London is you can produce pretty pictures like this. So we can see, starting at 6:20 in the morning, I like to think that of the lone head teacher winding their way into school by 6-7 a.m. And then the other teachers and children start to travel into the school location. And you can see some of them travel quite long distances from the northwest, southwest, but the majority of them are in the little sort of group in the middle. And the different colored dots are the different pollution concentrations. So we're up to about 8:30 here. Then you've got the stragglers desperately trying to make it in for the school bell, just about making it for 9 a.m. So in animated terms, we can see the kids moving into the school, and we've got other maps showing them moving out of the school. The mornings were quite predictable. They traveled from home to school. The afternoons were a lot more random. They went to after school clubs, they traveled to friends' house, they played in the park, etc. And we had to sort of try and deal with this change in behaviour in the afternoon. So across this particular school, we were able to produce static maps such as this. And what's immediately obvious is you don't get a very nice resolved map where all of the back roads are nice and clean, and all the main roads are much quicker, much higher concentrations. But you do get general patterns. Sorry, I've got an auto advance on here. So in general, the main roads tended to have higher concentrations and the back roads lower, but it's not quite as neat as you might expect. So when we compare the average exposures to PM2.5 on their way to school in red, while they're at school in green, and traveling back from school in blue, across all the schools, we can see that the morning exposure is the highest, then the afternoon commute home, and then while at school, it's actually the lowest exposure to air pollution, the cleanest levels. Generally speaking, this differential between the morning and the afternoon will be partly to do with weather conditions, lower dispersion rates, etc., and partly to do with, as I said, this sort of different patterns of behaviour in the afternoon. One other thing I'd like to point out is we did get differences between the schools. So school A happened to be on a particularly wet and windy week. So while we saw the same patterns, the absolute concentrations were much lower. Whereas school D, for example, was a much more settled week. So these weather conditions make a big difference. And this was one of the strengths of the study. By monitoring all the kids in the same school in the same week, we were able to allow for this difference in weather. If we were comparing children across different weeks, we would have got different results due to the weather, which would have confounded our conclusions somewhat. I thought this was quite encouraging. Across the 5 schools, 60% of the journeys were by foot, and at some schools it was very high. So example, school A here, nearly 90% of the children walked to school. This was a very small catchment area. Most of the kids travelled very short distances. We deliberately chose school E to be one with, it was a faith school with a much broader catchment. So we got a much greater range of travel modes to school and a much lower pollution, only 40% walked in. So again, we got a lot of heterogeneity even between schools, not between participants. But generally speaking, most kids walked to school and most journeys were quite short, which I think is good news. Going back to that map, if we average pollution concentrations across main roads, back street, and different modes of transport, we can see another pattern forming. Generally speaking, walking along the main road produced the highest mean concentrations. This is the average in the morning and the afternoon. Walking on back street with the lowest, and motor vehicles were somewhere in between. We did see some pretty extreme values in each of those categories. So in the motor vehicles, for example, some of the children were exposed to high levels within that vehicle. While walking, also the kids came across hotspots, might be road junctions, there might be specific vehicles. So there's a lot of variability. And again, to really capture that variability, you've got to monitor a lot of children. This highlights that variability. This is a time series chart from one particular child traveling across London to school. One in the morning, one in the afternoon. Two children, sorry. This one in the morning is the child getting into the vehicle at around 8:50, traveling into school and getting to school about 9:10. You can see as soon as they get in the car and start traveling, it rises up and there's some significant peaks there. They get to the school and the levels drop back down again. The walking commute's a bit more variable, but you can see these big spikes occurring as they cross the main road and go through busy junctions. So a lot of minute-to-minute variability within each child. And finally, for my section, I just wanted to highlight something that really puts this in context. And this is a bit naughty because we're now talking about indoor air and not schools. But this behavioural aspect is really, really important. I've pulled out this one particular child. So this is one child out of 258, because we can see the school commutes on each day, Monday, Tuesday, Wednesday. Their exposure to PM2.5, when you compare to their exposure inside the home in the evenings, is relatively low. And for this particular child, their principal source of exposure to PM2.5 is the evening meal. And this was not unique. It was not even unusual. There was a significant number of kids who had really quite high indoor exposure to PM2.5 in their home environment. More promisingly, we also saw traces like this. So this particular child had a very clean home environment, took a relatively low pollution route to school, and had a low school environment. So this child, on the same day, in the same part of London, had much, much lower pollution levels. And that's down to behaviour, not down to weather or geography as such. That's the individual behaviour of that child, which I think is still important. You can still see the commutes there just dipping in. And finally, this third example I had to put in because this really highlights other things that you may not expect. And you can see the kind of exposure levels that this child had, really high concentrations of PM2.5. And we're pretty confident that this is a child whose parents smoke in their home environment. So we have to think about the school in context and sometimes those conditions. And I think still the schools have got a role to play here. And in this particular case, we raised this as a concern with the school teachers, and the school itself contacted the parents of this child. We went back and monitored in a month later, and indeed PM2.5 inside the home had dropped dramatically. So that wasn't our responsibility. The school took on that responsibility, but we assisted them with it. So I'm now going to hand over to Diana to talk more about the social engagement side of this. So I'll stop sharing, Diana, and hopefully switch to you.
Thank you, Ben. Can you see my screen?
Yes, I can, but you're not in presentation mode.
There we go. Is that all right now?
Yeah, that's perfect.
Okay, thank you. So as Ben was highlighting, we follow a participatory approach, a citizen science approach to data collection. So our idea was to bring the children into our work and make them part of the research process as much as we could, from the beginning to collecting the data to disseminating this data. So what did we do and how did we do it? So first, we wanted to raise awareness and we wanted to raise understanding. So we wanted to move from there is an air pollution problem and we all have heard about this and we see it in the news, to actually start these discussions and conversations with the children about what really is air pollution, what are the causes of air pollution, what are the effects of air pollution in our health, and what can we do to reduce our exposure to air pollution. So we ran education sessions right at the beginning of the project. That was the first thing we did, and then we did another education session after they received the results. We wanted to make air pollution visible, and that was the great opportunity that these bags and these sensors gave us. They allow children to gather their own data and move from something that is generally invisible to something that is tangible, so something that they can actually see in a map. They can actually see the data they gather throughout the whole school week. We want to make it personal, so we didn't want air pollution to be issue about London, nor even each of these local authorities where we carry out the projects. We want to be something from the neighborhoods, from the trip from the house to the school and from the school back to the house. So we could then discuss the findings in relation to the social context and where the dynamics of the livelihoods were happening. And of course, we wanted to provide choice. So it wasn't just about going and asking them to help us gather some air pollution data and engaging with them, but it was actually a finding in ways in which children could reduce their air pollution exposure, things that they could do, things that are achievable and are within their power. So in terms of the methodological approach, we use mixed methods. We wanted to assess the impact of our intervention in terms of gathering the data using the bags, the education session. So we did surveys before the project started to kind of have a baseline, and then we did surveys again at the end of the project, about 3 weeks after we gave them the feedback, the results. We also did focus groups after the project took place, we were supposed to do focus groups, 5 focus groups, but absolutely everyone had something to say. So we ended up doing 20 focus groups, which they were not really focus groups, they were just, everyone was there. So it was fantastic just to hear the feedback from all the children. They were really, really engaged. And we also did interviews with 10 teachers across the 5 schools. After we finished gathering the data, we provided children again with deliver another education session where we went again through the findings, and we allowed these spaces to discuss what the findings meant for the children in relation of the activities every day. We gave the children reports like the ones you can see in the screen now. So we tried to make them as clear, as child-friendly as possible, so they could have something that they could look at and also bring it home and talk to the parents about the findings from their project. So the impact of our approach. Children using the citizen science approach, using a participatory approach for data collection. Through that, children can learn about air quality. We found that children post-intervention reports, we did the study, children were a lot more confident talking about air pollution. They're talking about gases, they're talking about the different sources of air pollution, within the neighborhood, and also the things that they could do themselves to reduce their exposure to air pollution. So before we told them about things that they could do, they actually were coming with ideas themselves throughout the discussions that we were facilitating in the school. And it was also a relief for many of the children to know that there was something that they could do. So air pollution moved from being a scary thing that we don't know about and we can't see, to something that we can actually identify where I am exposed to highest levels and what I can do about it. And the teachers and the parents did agree with the findings, so with what the children were reporting in terms of what they learned about air pollution. And the teachers highlighted that having participated in the project, having gathered data, empowered the children to identify ways in which they could change within their power their behavior to reduce exposure to air pollution. Children conduct research in air quality. Children were an active part of the research process, and this was very, very interesting because they not only learn about air pollution, but we also inspired them to think about science and science-related subjects. So we were getting questions about, how is the monitor working? Is my bag heavy because I am carrying all this air pollution? Where are you emptying all this dirty air? And it's kind of inspiring, giving the opportunity to start asking these questions. And for children of this age, we see children from GR2 all the way to GR6 asking these questions and questioning how we're doing things, how are these sensors working, what data I'm actually gathering. So children felt like air quality scientists throughout the week. And that was something, again, that was reiterated by the teachers, that children were empowered throughout that few weeks that we were in the school to talk about air pollution, to learn about air pollution, and to do the research in air pollution. And children act for air quality. Some of you that have children, you know that even if we don't want to hear what the children want to tell us about what they did in the school, they will still tell us, because they are fantastic disseminators of information. And this is something that we got from the children, and then the parents again told us, you know, my child, after he did the class, he will tell me not to drive to school, or maybe we can drive half of the way, maybe we can do park and strike, park away from the school and then walk the rest of the way. So children can definitely have, or they have a role to play in disseminating this information. And also, these are the future car owners. They will decide how they're going to build the houses. They're going to decide how many trips, how many holidays they're going to have to the year, and what is the carbon footprint. So this is where we're starting now, and this is the message that they're going to start taking throughout their lives. And the impact of our approach stimulated positive changes in behavior within the school and within the school community. So we heard from one of our schools that more than 50% of the people that normally drive to school is now they are walking or cycling or using the scooter to go to school. And the head teacher was telling us that actually they have to provide the children with more scooter parking space and buy another shelter for the bicycles, because after the study, the children were just really enthusiastic about scooting and cycling, and encouraging the parents to let's just go a little bit earlier today so we can cycle or we can scooter, and doing all these things to reduce their exposure to air pollution from what they have learned. And overall, as a result of taking part in the study, 31% of the children and parents that we questioned that took part in our survey say that they changed the way they commute to and from school. Again, adopting environmentally, they changed the behavior, the way they commute to and from school to reduce the exposure to air pollution. So our conclusions, we know that with suitable technical support, these portable air pollution technology, these wearable sensors, give us a great opportunity to carry out projects with children and of course with other communities. But I would like to highlight this with suitable technical support. So they still need to, especially with the understanding of the data, what the data means and how we contextualize this in the terms of what things we can do to reduce exposure. We also identified that a participatory approach can stimulate compliance with the study protocols. So to run out to run a project of this size with 258 children across 5 primary schools, you really need them to adhere to the study. Otherwise, you're going to end up with 100, or they will drop out. Half of them, they will carry the bag for 2 days, and then they will just leave it and won't carry on to it. So using a citizen science approach, really engage them into the process and empower them to do this, not because we are asking them, but because they want to do it, because they feel like they're an active part of the research process. They own the project. Raising children awareness to air pollution and involving them into the process can lead to positive changes in behaviors. And yes, we saw it. People, families change the way they commute to and from school. And finally, understanding when and where children are exposed to higher levels of air pollution will allow us to focus resources in these areas. It can either be research in these areas, or it can be policy interventions in these areas, or resources to tackle the problem. And this is some picture of the badges that Ben was talking about. And we would like to thank all of our air quality scientists and the teachers for their help with this project. So I think we will be ready for any question, Paul.
You're muted, Paul. You're muted, Paul.
Okay, sorry. Yep, I've been chattering away. Yeah, so first of all, thank you very much. I thought that was a fascinating presentation from both of you. So thanks very much. It was very interesting and clear. We have a number of questions in the chat and plenty of time for questions. I'm going to start. So you showed in your presentation, Ben, first of all, a high variability of exposure, for example, at peaks in crossing roads and so forth. And you also showed the sort of average levels over the commute compared to the time at school. I mean, part of the perceived wisdom is that dose matters. And you didn't talk about dose. So I just wonder what your comments are. I mean, even though the pollution level is lower in school, is the dose over the day still larger? And where should our concentration of be, what should we focus on here?
I think I'm going to answer that in a fairly roundabout way. Yes, the commutes were typically quite short, particularly in time in terms of proportion of the day. The exposures tended to be.
Leora, can you move this? Thank you. Go ahead.
The nature of the exposure is quite different. So if you simply multiplied exposure concentrations by time to get dose, then it would be much smaller than the average overall. However, we got some very high spikes within that. And this also comes to the point about different types of action, different types of legislation. I think my answer to you would be we need to do both. The nature of what we need to do about it is really different. So one is talking about behavior, how we travel to and from school, how we facilitate that approach, how we educate people. The other one within the school environment is beyond the power of generally speaking, beyond the power of the children and the parents themselves, but that's within the remit of the school and the local authority and the government. So given that the actions required are so different, I would say that it's perfectly reasonable to concentrate on both of them. I will say that this is another area where science evidence is yet to catch up. We don't really know the health impact of short, sharp exposures to air pollution. This approach in theory can help with that evidence, but to do so we would need to look at acute health responses to those short exposures, which is something we're attempting to do, but we don't yet know how important they are.
Yeah, thanks. So I'll read some questions out from the chat. So from Hugo Russell, he asks if you tested the sensors both indoors versus outdoors, do you think the performance would be the same indoors at lower humidity, greater temperatures compared with outdoors? Quite a technical question here, I think.
Yeah, I mean, this is something our wider research is looking into. We didn't for this particular study, and there are humidity effects and there are artifacts from changing from cooler in or temperature changes as you walk in and out of buildings. We haven't stressed throughout this the absolute concentrations. We've always kept it relative. And the study design was such that we were always making relative comparisons rather than absolute concentrations. And there's a few reasons for this. One is to do with instrument performance, and we could not be, while we were confident that they performed well outside, when used as a portable monitor, it's much more challenging. So by quoting absolute numbers and making a big deal of that, we're roping ourselves into that sort of pitfall. Secondly was this point about the health impacts of air pollution. Because we can't say to the parents, it's okay, your child was exposed to levels below 20 micrograms, you've got nothing to worry about. We don't know that. We don't know where the threshold is for short-term exposure. So we deliberately avoided absolute concentrations. So I'm kind of dodging your question a little bit there. There is likely to be some change in performance, but we tried to design the study so that wasn't tremendously important.
Thank you. So from Peter Knapp, said the dinner PM 2.5 exposure was much higher than lunch. Does this mean the school canteens didn't supply hot meals or were well ventilated?
They did supply hot meals. They were also much larger rooms and they were well ventilated. The commercial kitchens in schools have got extraction systems, etc. And we're finding this in homes. We're seeing homes which have got very poor ventilation, but it's also what they're actually cooking. So I think that in that particular case, it was sausages being fried. So there's a number of variables which will dictate the exposure levels. And in fact, there was one child we knew particularly well, and we asked what did they cook on each day, and there was a strong difference between what was actually cooked in the same kitchen. So lots of things to think about. Ventilation is really important.
Good, thank you. And one from Paul Ajiboy saying, was it clear at the beginning to staff and students that individual results might lead to feedback at parental level? I guess that's for you, Diana, really.
Hi. For this type of studies, we have to go through an ethics process, and we have to have a participant information sheet where we tell participants, parents, children, teachers, what the study will involve and what they will imply. We told them that we will gather air pollution data from this week. We will identify where and when your child is exposed to the highest levels of air pollution, and we will then identify ways you can reduce that exposure to air pollution. So we did not tell them you might be the one to blame, which is not the case. We work together to identify ways, you know, in which we both have to, well, we both see like children and parents can do things to reduce their exposure to air pollution. In this case, children, because they are just little children, they depend a lot on whether the parents allow them to scoot or cycle to school. So it's a two-way process, really.
Right.
Can I make an additional point on that, which occurred to me earlier? We're talking a lot about exposure to air pollution, and you can reduce your exposure either by changing behaviour such as commute, travel route, etc. But that depends on you. The other way to reduce exposure is to improve ambient air quality, and that, of course, is a big part of this, that we use the engagement methods to talk about exposure in a broad sense, and encouraging people not to drive their car also improves air quality, reduces emissions, as well as reducing their exposure. So we have to be cautious. We don't just teach people to avoid a problem. We have to solve that problem as well.
Yeah, and this relates quite nicely to a question from Megan Davis-Wykes, who asks, do you think the low levels of pollution in school A is partly to do with the low numbers driving to school and the short journey times, as well as the difference in weather?
I'll say yes. The reason I'm hesitating is I'm wondering whether we've done that analysis. I think particularly with PM 2.5, because you've got a relatively large regional component of PM 2.5, that will strongly be dictated by the weather. So southwesterly winds, the background concentrations would be relatively low, independent of what mode of transport or how long their journey is. So not all of that will be down to behaviour, but it probably does contribute. The NO2 levels, though less robust in terms of data quality, were less susceptible to those regional weather conditions. So I can't remember off the top of my head whether the contrast between school A and school D, for example, is so great for NO2. I would guess not.
Okay, thanks. And I guess from Paul Edgerboy again, is there enough data yet to look at different ventilation approaches in schools and the effect on concentrations?
You know why I'm laughing, Paul. No, I don't think there is. What we need is a nice study that will help explore that.
Yeah, I agree. Okay. So for Diana, I think from George Papachristou, did you have any issues with participants in relation to confidentiality, sensitivity of the data?
We didn't. We, as part of our information sheet, we told participants that in order to keep their homes for GDPR and all these, we remove 100 meters radius of participants' coordinates, because the units had a GPS unit, so we were able to see where the participants were as we were recording the air pollution measurements. So in order to ease or to help with this issue of sensitivity and data protection, when we got the data as part of our data processing, the first thing we did was to remove 100 meters radius from the participant's home. So we knew where about the house was, but not specifically where it was. So that was, which probably will be the biggest issue about sensitivity. And all of our data, after we got the backs back from the children, all of our data was anonymized.
Right.
It was also encrypted as well.
Yeah. So
had a bag gone missing during the study, no one would have been able to get any of the data off it.
Right. Okay. And kind of follow up, I think, in a way from Mark Winterbottom, again, I think for you, Diana, you mentioned a survey for children. Could you provide a little more information about the findings for students which came from the survey and those which came from the focus groups? So did the focus groups come up with anything unexpected?
Well, regarding the surveys, yeah, we did 700 surveys in total before. So we did surveys with the children before and after the study. There were 258 children. We also did surveys with the parents. And what part of the survey was to help us contextualize our findings. So we were asking children and parents how they travel to school. So to help us gather that data, what year group they were, how long it will take them to go to school. So all this information kind of fed into our results. And then we also have open questions when we were asking the children about what you think air pollution is, how you think it's affecting your schools. And so this was in terms of the surveys. And in terms of the focus groups, we kind of follow the same stuff from the surveys, but then we allow them, children, maybe they're very good at expressing themselves, talking, but not necessarily writing. So the focus groups was a way of giving them the opportunity to go again through this question, but in a way that they could actually talk and tell us about this. I think something interesting that we found, and we are preparing a paper about this, we will be publishing in a teacher journal, is about the lessons learned and what we learned through the process, and what we learned from communicating these environmental issues in the school setting as researchers. So like, for example, things that children understood quite well, but things that they didn't actually get that well, and how we can improve in the way we communicate these issues to the children. So we are working on that to publish a paper that will address these issues and help our colleagues then when they are planning to prepare interventions like this, take into account.
Thank you. And from Mike Bithell, I think to you, Ben, can you get any information on what kind of particles are involved? He said, I'm thinking of exhaust versus tire wear, for example.
No, we can't separate out. Sometimes in some source types, in monitoring NO2 and PM helped us to differentiate, but so NO2 indicator of combustion, but that couldn't separate between exhaust and tire wear. There were different ratios between vehicle. There were PM 2.5 to NO2 different ratios between vehicle emissions and cooking, for example. So we could tell that. So to some extent, yes, but not to the detail that you suggest.
Right, right. And we've had a couple of questions or a comment earlier, and then a question now from Bethany Magridiaris. Sorry, I haven't pronounced your surname properly, Bethany. But she says, current local authority policy seems to look at concentrating traffic and pollution onto main roads. It seems unlikely, but does this research support this?
I'm actually going to answer that in quite a negative way. Our study cannot support that. And furthermore, I'm very keen to stress that what our data does show is that you can't simply walk down a road with a pollution monitor, whether it's with a child or a researcher, and map air pollution levels in that way. There's so much variability that you need to repeat sample over and over again, and there's some literature on this. So if you wanted to actually look at consistent mapping and changes, you would need to, well, I mean, it'd be interesting if you gave the kids the backpacks and they could monitor every single day of the year for several years. That would be great, but a week's monitoring is not going to tell you that.
Yeah, so I have two questions related to that. One from Peter Knapp saying, is there a plan to expand the backpack scheme to different schools? What's happened to the backpacks, basically? And then from Sarah West, I think, to say, do you plan to follow up with the schools to see if positive change in behaviours has been sustained long term? So I think perhaps from you, Ben, a comment on what you think, how you take this study forward from a technical point of view, and maybe from you, Diana, a comment about long-term behaviour.
Okay, so I'll refer back to Diana's point that the technical oversight was really important to this, to contextualize and interpret the output, the data, and that takes time. So it's not as simple as getting over the technical issues of providing a backpack. You then have got to manage the data and process it and interpret it, and that's, I think, really important. In terms of the fate of the backpacks, we are extending it. They were supposed to have been used in Birmingham by now, some schools there, but for obvious reasons that's not happened. They're being shipped out to several countries in Africa next month, and lockdown allowing in those countries, they'll be looking at school kid exposure in Africa. then they'll come back and they'll be used for various other projects. So we got a lot of requests to repeat this in a lot of other schools, and unfortunately our resources haven't allowed that. And it's not simply how many backpacks you've got, it's how much time you've got to deal with the data. As you saw, they produce a hell of a lot of data that you need to manage.
Yeah. And Diana, just to come back, did you see any, are you following up with long-term changes in behavior?
For this particular study, we did not design it in a way that we could then go back and assess changes in behavior. If we were going to do that, it has to be planned out right from the beginning, and it would probably have to be, we won't be able to anonymize the data as such, because we will have to go back and see whether each individual changed their behavior. So the study wasn't designed for doing this, and it probably open the opportunities for further research to actually take this into account longer term.
Okay, thank you. Thank you. Well, that's the end of the questions, and I think it's a good point to wrap up. Just to say two things. First of all, I'd like to reiterate my thanks to Ben and Diana for a very interesting presentation and for giving us such good answers to these questions. And I'd like to thank all of you who've attended today. It's been good to see so many of you here. This is, as I said, the first in a series of these seminars. The next one will be next Thursday at 12:30, and it will be given by Sani Dimitropoulou from Public Health England, and she's talking about some recent work that they've been doing on air quality around schools, and I hope we'll see many of you there. And as I said at the beginning, this is part of our outreach activities from the TAPAS project, and this network is an open network, so please, if you're interested and are not actively involved and would like to get actively involved or just get information from us, please make sure you contact either me or Sophie Bristow, our network manager, and we'll send you whatever information or link you in with people as seems appropriate. So with that, I think I'd just like to say thank you one more time. Hold on, something else, yes. Yes, and Sophie's just reminded me that her email, for those of you who don't have it and have a pen handy, is S for Sophie, B for Bristow, 2257 at cam.ac.uk. And with that, I'd just like to again thank you all for attending, and hope we'll see you all next week. Thanks very much.